All right, we'll go ahead and get started. Again, good morning. My name is Derek Hassert. I'm the current president of the Chicago Association for Psychoanalytic Psychology, and I would like to welcome you to today's event on behalf of our two sponsoring organizations, the Chicago Association for Psychoanalytic Psychology and the Chicago Center for Psychoanalysis. Before we begin this morning's presentation, I'd like to give a brief description of both of our sponsoring groups. The Chicago Association for Psychoanalytic Psychology is the Chicago branch of Division 39 of the American Psychological Association, otherwise known as the Society for Psychoanalysis and Psychoanalytic Psychology. We are a professional and educational organization that seeks to organize and present theoretically stimulating and clinically useful workshops and seminars throughout the year. The Chicago Center for Psychoanalysis is an independent, self-governing institute for psychoanalytic training, offering a full training in psychoanalysis, as well as a 2-year training certificate program in psychoanalytic psychotherapy. The Chicago Center also offers individual courses through its Psychoanalytic Explorations program. Now to today's presentation and today's presenter. It's my privilege and honor to welcome back to the Chicago Association for Psychoanalytic Psychology, Dr. Donald Carveth. Dr. Carveth is an emeritus professor of sociology and social and political thought at York University in Toronto, a training and supervising analyst in the Canadian Institute of Psychoanalysis, a past director of the Toronto Institute, and past editor-in-chief of the Canadian Journal of Psychoanalysis. He is the author of The Still Small Voice, Psychoanalytic Reflections on Guilt and Conscience, Psychoanalytic Thinking, a dialectical critique of contemporary theory and practice, and his most recent work is entitled Guilt, a Contemporary Introduction. Dr. Carveth has a podcast available on Spotify entitled Psychoanalytic Thinking with Dr. Don Carveth, and he also has an informative series of video lectures on numerous topics in psychoanalysis available through his YouTube channel. Many of Dr. Carveth's academic papers can be found at his website, doncarveth.com. Dr. Carveth is in private psychoanalytic practice in Toronto. So without further ado, Dr. Donald Carveth.
Thank you, Derek. Very pleased to be with you. Looking forward to actually being in Chicago a year from this spring, but very nice to be able to communicate this way as well. Rutledge wanted my new book. Well, they insisted that any books in that series be a maximum of 40,000 words. And so that worked for me. I'm visually impaired, but I was still able with the iPad to knock out the 40,000 words for the third book. I'm going to be drawing very much on that, but going beyond, because my thinking does seem to keep evolving. I started developing the argument about our need to have a conscience separate from the superego. Freud in 1923 folded conscience into superego. I think that was a mistake, and I've been arguing for some time about our need to separate them out. But the theory keeps expanding a little bit, so I hope to be able to outline that today, as well as discuss clinical relevance and applications of all of this. So I want to start just by talking about guilt evasion. And it's not just our patients who evade guilt. We evade guilt. Our culture evades guilt. Psychoanalysis has been evading guilt for 5 or 6 decades. It was in 1960 that Sandler in England reported that clinicians at the Hampstead Clinic seemed to no longer be organizing their clinical material around the concept superego. They were organizing it around transference, counterjob, but superego seemed to be disappearing. 20 years later, Arlo in New York made the same observation. People were not talking about the superego anymore. They didn't seem to be talking much about guilt anymore. As a sociologist, I was drawn to Marxian analysis, and I still have that orientation. The society was fleeing from guilt and was fleeing from regulation. This is neoliberalism. Privatization, deregulation of the economy and the society, and at the same time as the society was hostile to becoming more and more hostile to regulators, so psychoanalysis, which after all is a part of the culture. Psychoanalysis is a part of the culture. When the culture is in flight from regulation, superego, conscience, guilt, then psychoanalysis follows suit. And we turn to the study of all kinds of other things, but we stop talking. At least many of us. Look, I mean, there were always some old holdouts, old Freudians and Kleinians who continued on understanding the importance of superego and guilt, but there was a real shift away, guilt evasion. Starting in about 2010, guilt started coming back into the radar of psychoanalysis. A spew of books, including mine, 2013, a bunch of other books began to appear, concerned with issues of guilt and conscience and superego. I want to make it clear that when I'm talking about guilt, I'm talking mainly about unconscious guilt. And I know we all understand what that means, but at the same time, I don't think we entirely get what it means. This wonderful quote, one of my favorite quotes from Freud, 1923, The Ego and the Id. He writes, "In the end, we come to see that we are dealing with what may be called a moral factor, which is finding its satisfaction in the illness and refuses to give up the punishment of suffering. But as far as the patient is concerned, this sense of guilt is dumb. It does not tell him he is guilty. He does not feel guilty. He feels ill." And so, in my view, good psychoanalytic work means developing the capacity to not conclude, but at least suspect that the suffering the patient brings in that appears to have nothing whatever to do with guilt or superego. It may well have everything to do with guilt and superego. The guilt is unconscious, but patients come suffering from migraines, from all of the symptoms that we see. And all of these symptoms involve varieties of suffering. And a lot of that suffering turns out to be punishment, a manifestation of unconscious guilt. Panic attacks. I get all of these businessmen who think everything is going wonderfully in their businesses, but they're suddenly out of the blue, they're having panic attacks. No clue that this has anything to do. It turns out that these guys are usually very angry, but they don't know it. They refuse to know how angry they are. But the anxiety is that the anger is going to erupt like Vesuvius. They're terrified that their anger will erupt. Hence the anxiety attacks. Very much involved with guilt and superego. Okay, the big distinction, unfortunately one that Freud himself did not get, it was opened up for us by Melanie Klein and I'm blocking on the name of the Latin American, Leon Grinberg, two types of guilt, persecutory on the one hand and reparative on the other. So I always use the illustration. I've been in a fight with someone and he's bleeding in the corner, and I have picked up my cat o' nine tails and I'm whipping myself. I'm so bad, I'm so bad. Useless to him. if I put down my cat o' nine tails and pick up my first aid kit and start bandaging, I've shifted from persecutory guilt to reparative guilt. Persecutory guilt is entirely narcissistic. It's all about me and how bad I am. Every once in a while, people are able to glimpse the world beyond the self, something that is very, I guess it's always been difficult to do, but in the culture of narcissism, it's very difficult to get past ourselves, to notice the guy bleeding in the corner and go get the first aid kit. So these are the two fundamentally different kinds of guilt. Shame. Shame is also, like persecutory guilt, narcissistic and persecutory, but I don't think there is any reparative shame. I mean, in guilt, we've got persecutory guilt, but sometimes we can shift to reparative guilt. I think shame is certainly persecutory. I think it remains narcissistic. Maybe you can help me if you can think of examples of reparative shame. I've not been able to get my mind around that one. In fact, I think that shame and guilt come on the paranoid schizoid level. They're both persecutory, and I think the distinction between them is a little bit moot, actually. They're both forms of self-persecution. The ego ideal, I feel, is also a narcissistic structure. When I say that we should have a conscience as a separate structure, along with id, ego, superego, and conscience, people say, can't this be handled by the ego ideal? No, because the ego ideal is an entirely narcissistic structure. When you're comparing your real ego to your ego ideal, your mind is entirely on yourself. You might be saying, I'm not the man I ought to be. And that sounds like a worthwhile moral reflection about oneself. I've fall short of my ego ideal. But in that meditation, your mind is entirely on you, not on the guy who's bleeding in the corner. The way I like to put the distinction is many people, it's part of their ego ideal that they want to be a good parent. And but there's a big difference between wanting to be a good parent because you want to see yourself as a good parent and be seen by others as a good parent. That's quite different than winding up happening to be a good parent because you love the kid. And the kid knows the difference. The kid knows the difference, whether the parenting he's receiving is coming from the parent's narcissistic need to see himself as a good parent or coming from the parent's dumb love of the child. So, yeah, the ego ideal does not function as a conscience because the conscience is oriented to the other. So this is Winnicott, the capacity for concern, the development of the capacity for concern. That important Kleinian paper written by Winnicott is about the child's capacity to start caring for the other. Okay. Sometimes I think maybe we need to reserve the word guilt for reparative guilt and simply call persecutory guilt and shame self-persecution. Both are narcissistic states of self-obsession and self-attack, self-persecution. Maybe we should reserve the word guilt because, of course, Freud in 1931 in Civilization was talking about the buildup of guilt in civilization, because civilization, in order to have civilized order, we have to somehow inhibit our antisocial impulses. If we could avoid repression, we'd be better off. But very few people have the capacity for suppression, which is consciously knowing about my dark impulses, but simply refusing to act on them. That's tremendous self-control. I'm not going to lie about my dark side, but I'm just not going to act it out. suppression instead of repression. That way you avoid the return of the repressed, because every time you resort to repression, you're setting up the disguised return of the repressed. But if you can go to suppression, or if you can go to sublimation. But Freud says the trouble with both suppression and sublimation is it takes a lot of talent. And probably most people don't have the talent for suppression, and they don't have the talent for much sublimation. So most people are falling back on repression, which sets up the return of the repressed. And that leads to this buildup of guilt in civilization. But the guilt he has in mind is entirely persecutory, because he doesn't recognize the distinction between persecutory and reparative. So he's quite right that in civilization, we'd be far better off with less persecutory guilt. But he does not recognize that what we need is a great deal more reparative guilt in civilization. Less persecutory guilt, more reparative guilt. And right there, we have what I think is a good way of describing what we in psychoanalysis and analytic therapy, what we are about. What's our goal? You know, we're not supposed to announce our goals. We're not supposed to be moralistic, but we are. The whole discipline is a moral enterprise. We're trying to help people evolve from persecutory guilt towards reparative guilt. And I will argue that that's the evolution from superego to conscience. The Kleinians call it the evolution from the paranoid schizoid position to the depressive reparative position. That's what we're about. That's what we're trying to help people achieve. Let me go further on this, just to be provocative. I think we're out to convert people. That's a conversion. If you take a person who's ensconced in the paranoid schizoid position and the narcissism and the splitting and the self-persecution, and you help that person evolve into the depressive reparative position, that's a conversion. You know, we usually think of a conversion as a great sudden thing, like Paul on the road to Tarsus. You know, no, it's a slow conversion. We know how long it takes, but it's still a conversion. It's a slow conversion. And they're living in this one world called PS, and we help them evolve into another world, D. I think we should recognize that it's something like a slow conversion. And we should recognize that that's what we want to happen. That's our goal. That's why we came into the field. We're not supposed to be moralistic. We're not supposed to be superegoish, of course, but we got to stop denying that we're engaging in a moral enterprise, psychoanalysis. We're very subtle about the way we engage in this moral. We don't hit people over the head. We give them space and containment and holding, and we have a tremendous amount of patience. But it's very clear what we want to happen. But we've been lying to ourselves and other people about this since the beginning. Freud wanted it to be science. There are scientific elements of it, but overall, we want people to choose life over death, love over hate, and truth over lies. I think we should admit it. My colleagues up here, my medical colleagues, psychoanalysis is covered by socialized medicine up here, if practiced by an MD. And I think if they came out and admitted what we're really about, probably OHIP would refuse to pay. So I can understand that for practical reasons, people might want to think that it's a medical act, when in fact, in a very broad sense, it's a moral act. I think we want people to become more conscientious, not superegoish. Okay, we need more reparative guilt in civilization. Okay, for Freud, guilt and shame involve id aggression turned against the self. This is the origin of the superego. At the end, for Freud, at the end of the Oedipal phase, at 5 or 6, due to castration anxiety, this is how we get a superego. Superego is id aggression turned against the self, plus the internalization of the parental superegos, the internalization of the cultural norms. But the core of the superego is id aggression, deflected away from the objects back onto the self. And this happens at the end of the Oedipal phase when the kid gives up his Oedipal project. Okay, Dad, you can have her. I'll get one of my own. And I'm going to not be wanting to kill you anymore, Dad. I'm going to identify with you instead at 5 or 6. And from there on in, the superego operates, quotes, this is Freud's phrase, like a garrison in a conquered city. Now, it's worth pausing to think what he's saying there. We become moral, we get a superego, we're driven into it by castration anxiety. And once we have the moral authority internalized, it operates like a garrison in a conquered city. We are a conquered city. We are a conquered city. This is supposed to be healthy resolution. This is not healthy, in my view. This is pathology. To wind up feeling like you're living in a conquered city and that you've developed this superego out of submission, out of fear of castration. To think that our moral sensibility comes from this, I'm going to argue that our moral sensitivity is biologically built into us. I'm currently arguing that conscience is grounded in what I call the pro-social id. We've had this biased view of the id as the origin of our darkness, but the id is also, well, eros belongs to id, not just thanatos. The life drive is an id drive, not just thanatos. Okay, I'll say more about that in a few minutes. Okay, Freud found the origin of the superego at the end of the Oedipal phase. Melanie Klein found its origin in the first year of life as the child's introjection of the bad part object, the persecutory breast. Oh, sorry. Sorry about that. So Klein sees the core of the superego as identification, introjection and identification with the bad part object. So the later Oedipal superego is an expansion, an extension of an internal persecutor that's been there since the beginning. My argument is that conscience, as distinct from superego, has a biological basis plus introjection and identification with the good part object. The hostile superego is an identification with the bad part object. Conscience is based on, well, it has biological roots that we share with our primate cousins, but then it also involves introjection and identification with the good part object, the good breast, and also with the nurturers, with those whose care kept us alive. We identify with them. So I think conscience has this biological basis, but then it involves identifications. So the superego, in my view, is fueled by hate, conscience by love and concern. That's a little too, I have to revise that. I mean, in health, and I'm going to explain this, but in health, we still have a superego. We need a superego. We need the law. We need a rule book. But in health, what I see is a superego disciplined by conscience, a superego that is called out by conscience, a superego subordinated to conscience. That's not a hate-filled superego anymore. That's a converted superego. Okay. Most of the sufferers who come to us have persecutory guilt rather than reparative guilt. I mean, maybe sometimes we get some mild neurotics who are already living in the depressive reparative position, and but even they, what brings them to treatment is not reparative guilt; it's persecutory guilt. I mean, even in the depressive reparative position, you still get persecutory guilt. I mean, I have a bit of a problem. Frankly, over recent years, I'm having more and more problems with the Kleinian PS versus D binary. It's too binary to begin with. There's a whole area in between PS and D, a transitional area between PS and D. It's very useful when you're first sitting down with a patient, trying to get an assessment of what's it going to be like working with this person? Is this person living mostly in PS, or are they living a good deal of the time in D? That's useful at the beginning, but it's also misleading in a number of ways. People who have reached the depressive reparative position still suffer from persecutory guilt and shame. But I guess my point here is that it is mostly persecutory guilt and shame that bring people to treatment. So in addition to being formed through identification with good objects, conscience has a biological basis. Just as Bowlby posits a universal innate instinct for attachment, like other primates, we come into the world with this innate instinct for attachment. So there appears to be in humans and other primates a universal innate instinct to cooperate with and help others, a cooperative drive. There's interesting research in psychology by Tomaselli and his colleagues, DeWall's recent work on primates, Paul Bloom's work at Yale on 3-month-old children who already have a conscience. They always choose the helpful bunny, not the harmful bunny. Mind you, it gets complicated when the harmful bunny comes with some cookies and the helpful bunny doesn't come with cookies. The kid is corruptible, but very early on, they show a marked preference for the helpers rather than the frustrators. That's Paul Bloom's work. When I left Marxism, Leninism many years ago as a young man, I turned to anarchist theory, Prince Peter Kropotkin. He was a scientist. He went into northern Siberia and northern Manchuria, where they have these terrible winters that last, about 10 months of the year. And it's incredibly difficult for animals to survive in that. And he studied the creatures that survived, and he found that they survived not by competing for survival, but by cooperating. That's what enabled them to survive. He realized he was not accusing Darwin of creating this false image of survival of the fittest and all of that, or the each against all struggle for survival. That is in Darwin, but Darwin had other things to say. That wasn't a consistent theme in Darwin. And certainly many other thinkers have tried to correct that picture. So that's Kropotkin's work. The title of his book is Mutual Aid. So these more recent researchers like Tomaselli and DeWall and Bloom and so on, essentially they're working in a Kropotkin, they're the inheritors in certain ways. I think most of them don't even know about Kropotkin, but they're certainly supporting his. Chomsky, Noam Chomsky, long resisted the postmodern Foucauldian, postmodern relativism. Everything is a social construction. There's a video on YouTube of Chomsky 30 years ago debating Foucault. And Chomsky is saying, come on, we're animals. We come into the world with a particular kind of brain that allows us to develop language. Chomsky is a supporter of the idea of a human nature that is not merely a social and historical construction. And part of our human nature is this cooperativeness with our fellow creatures. Of course, this is not to deny, I'm not trying to create an all good view of human nature versus an all bad one. We're capable of plenty of destructiveness, and we are far more destructive than other species because we have language and free will and all kinds of destructiveness. But we do also come with this biologically based cooperativeness. So I'm talking about the pro-social id, because in Freudian theory, the id is the biological inheritance, and part of that biological inheritance is the pro-social id, which is not to deny the antisocial id. We have this profound ambivalence. You know, Freud said any human relationship that reaches any depth is characterized by ambivalence. But then, of course, he immediately says, except perhaps for the relationship of a mother and a son, he says. He couldn't allow his statement to stand that all relationships are characterized by ambivalence because he couldn't allow the idea that he might hate his mother, which there's evidence that he did. So he makes that bizarre exception to the rule of ambivalence, which is hilarious, really. Okay. The pro-social id as the origin of conscience, as distinct from the socially constructed and socially relative superego. Again, it's another one of Freud gave us the superego, but he seemed not to notice that the superego that is formed through internalization of the parental superegos and so on, this is where we carry our racism, our sexism, our heterosexism, our classism, our materialism, all of those antisocial or asocial ideologies are carried by the superego. Okay, we need to reverse Freud's 1923 decision to subsume conscience into superego, so we can begin to see conflicts between superego and conscience, which we've been blind to. It's hard to see things if you don't have the words and the concepts to be able to see them. So we didn't have a separate conscience. Therefore, we couldn't talk about conflicts between conscience and superego. When I spoke in Chicago before, I gave my mentor Eli Sagan's example of Huckleberry Finn. He's a product of a racist society. He's on the raft going down the Mississippi. He's joined by a runaway slave, Jim. As a racist, Huck thinks I've got to turn him in to his owner. So he starts writing a letter to the woman who owns Jim. But he can't bring himself, he tries to draw up a list of Jim's bad qualities to justify turning him in, but he can't find any bad qualities in Jim. So he's having a breakdown. He finally tears up the letter and he says, I'll go to hell, but I'm not turning Jim in. He goes with conscience instead of superego. We could talk about Ed Snowden, who had taken all kinds of oaths of loyalty to the American government, and he's working for his whole family or government. And then he sees what they're doing, and no doubt he had a huge struggle. And finally he said, okay, I'll go to hell. I'm going with my conscience. Now he's stuck over there in Russia. At least they let his wife join him over there. Our lives are full of conflicts between conscience and superego. It's scary to have a conscience because if you go with your conscience, there's a good chance you might get crucified. That tends to be what tends to happen to people of conscience because they're not team players. A person with a conscience is not a team player because certain values are more important than loyalty to the team. They're willing to throw the team under the bus if necessary, if conscience requires it. So okay. Important point. Persecutory guilt often serves as a defense against reparative guilt. Some of the more recent Kleinian, neo-Kleinians got this. Persecutory guilt can serve as a defense against reparative guilt. People often prefer to suffer rather than admit sin or wrongdoing. They prefer to go on suffering rather than admit they're bad. We live in a culture of narcissism. In this culture, about the worst thing you could do is admit that you're wrong or bad. We're always polishing our images. To admit that you were wrong, that you did bad things, that's very hard to do in the culture of narcissism. But if you don't do it, you won't have reparative guilt. You'll be stuck with persecutory guilt. You'll go on torturing yourself. And some people seem to be preferring to carry on with the self-torture forever rather than developing contrition and taking responsibility and acknowledging your brokenness. But that's the way to freedom. Admitting your sinfulness, and you're out from under persecutory guilt now. You've dropped the cat of nine tails now. You've picked up the first aid kit now. It's a liberation. It's an emancipation through the admission of guilt. But it's remarkable how people avoid that, like it's a catastrophe. Okay, by the mid to late 1920s, Freud, Alexander, and Ferenczi were calling for demolition. That's Freud's word, demolition of the hostile superego. Alexander said the superego is a vestigial organ, like the appendix. We can do well without it. Ferenczi said no analysis is complete without the complete elimination of the superego. Okay. There are problems with this. It was naive of them to think that the moral functions could be handed over to the rational ego. I mean, if they're going to demolish the superego, doesn't that sound like manufacturing psychopaths? No. The moral functions in their idea would be handed over to the rational ego. But this is highly naive because we've known since the 18th century work of David Hume that reason cannot deduce an ought from an is. Science is descriptive. It is not prescriptive. Reason and science can tell you how to build a bridge. It can't tell you whether you ought to or not. Where do we get the oughts? They can't come from science. They can't come from reason. So it was naive of Alexander, Freud, and Bernsey to think that the moral functions could be handed over to the rational ego. James Strachey in 1934 called instead for modification, not demolition, of the superego. He threw Alexander under the bus. When he talked about people who are naive enough to talk about demolition, he cited Alexander. He did not cite Sigmund Freud. He obscured the fact that Alexander was agreeing with Sigmund Freud. That was a political move on the part of Strachey. Anyway, he disagreed with them, rightly so. He was right to disagree with them. We can't demolish the law. We need the law. But my argument is that we also need a judge to judge the judge. Yes, we need the judge, superego, the law, but we need a judge to judge the judge, conscience, to call the judge to account. Okay, I think Strachey was right about that. He didn't mention the need for a judge to judge the judge. And Strachey gave us no clue as how are we to know in what direction the superego needs to be modified. Okay, it needs modification. Should we move it to the liberal? Should we move it to the conservative? No answer from Strachey, because he would have had to call for a source of that judgment, and that's conscience. And he certainly did not point in that direction at all. It's in our biologically based conscience that we find the core of universal values that are not socially constructed and relative. Not all of our values are social constructions, and not all of them are relative. I mean, around the world in playgrounds, you'll hear kids saying, "That's not fair. You had your turn. Now it's my turn." That's the law of reciprocity and basic fairness. Seems to be built in. The preference for life over death, the preference for kindness over cruelty. Now, we're free and we're able to go against these values. I'm not suggesting that they determine our behavior. I'm just saying we have them. We can turn a blind eye towards them, but we have them. Life against death, love against hate, truth against lies. These are part of the core value system that we seem to inherit. Grounded in the pro-social id. So, how do we cure? By modifying, not demolishing the superego, by liberating conscience, which is, in my view, equating to the true self. Conscience is grounded in the true self. And I think of the true self as non-representational. It's not a picture. It's not a representation. Winnicott defined it beautifully as going on being. The infant's going on being before it is disrupted by intrusion or abandonment. The baby's play before disruption. And of course, it will always be disrupted. And there will always be some element of switch to false self-development. That's inevitable. But I'm associating conscience with going on being and with the true self. So liberating our conscience is liberating our true self. So how do we do that? Um, many ways, but one part is by subjecting the superego to critique and discipline by the conscience. As conscious is grounded in the true self, going on being, we liberate the true self. But how? How do we do that? Well, back to James Strachey. I've criticized him, but that was a truly great paper. That's one of the greatest papers in the literature of psychoanalysis. Strachey's The Nature of the Therapeutic Action of Psychoanalysis, 1934. Another truly great paper is that paper by Brian Bird on transference, hardest part of analysis, and so on and so forth. I forget the rest of the title. He follows Strachey. What are we doing in psychoanalysis? And here I think there is a difference between psychoanalytic therapy and psychoanalysis. In psychoanalysis, we are trying to create the conditions for the emergence of a transference neurosis. Not just transference. Transference is ubiquitous. We're all having transferences all the time. But a transference neurosis in some patients may develop a year or 2 or 3 into an analysis. And by an analysis, I'm talking about something at least 3 times, if not 4 or 5 times a week. Very hard to achieve that nowadays. You can do it over the telephone. I don't like Zoom because we don't want to be looking at our patients. That's why we put them on the couch. So we don't have to look at them and they don't have to look at us. We're not interested. We want to hear their words, and the telephone is best for that. Telephone is the closest to having the patient in your office. And I've been working for a number of years with a guy in a faraway country, and there's a transference neurosis. It helps if the patient is in your office. Even if the patient is only in your office for one of the 4 appointments per week, that makes a big difference. I've had the experience of an erotic transference erupting after years of work on the telephone. The erotic transference would never have emerged until she came to my office. And then it emerged, and then we could deal with it. So I'm being pretty classical here, saying that in psychoanalysis, we want a transference neurosis. Now, what is a transference neurosis? It's the patient's core conflict, only he's living it out with me in it. I'm now a part of it. And we get all mixed up. You could say we go into the paranoid schizoid position together. We're not just outside it analyzing it now. We're in it. We're in it. And this is risky. Patients who develop a transference neurosis sometimes slide into a transference psychosis. There are psychotic breaks that occur and can then be healed. I don't rush the patient off to get risperidone. One modifies one's technique when the patient is psychotic. Psychosis is the risk you take if you take someone into a deep, full-scale psychoanalysis. And if you conduct it in a way that creates the conditions for the emergence of a transference neurosis, which can easily become a transference psychosis. Maybe a transference psychosis for minutes or hours, weeks or months. Most analysts get very terrified and want to end the analysis, which is a great shame because these things are, in one way or another, I don't like the word cure, but the patient comes out of it and often comes out of it in a state far better than they were in before they went into it. It's as if some patients need to have a psychotic break. I'm not promoting psychosis here, but I'm just saying a real transference neurosis where you could get into a fist fight with your patient. it's passionate. Both people go a little crazy. This is what we're doing in psychoanalysis. If our version of psychoanalysis is transference neurosis, we're gonna the patient's gonna go a little crazy, and we're gonna go a little crazy with them. Brian Bird makes this very clear. When there's a strong transference neurosis, there's going to be a countertransference neurosis. You're going to be drawn into it. Hopefully, your analysis has been good enough. Hopefully, your reality testing is good enough that you can mostly hang on to the boundaries and recover the boundaries and stay sane through this insanity of the transference neurosis / psychosis. Okay, that's what Strachey is saying. He doesn't make it quite as dramatic sounding. Brian Bird does. This is the classical psychoanalytic and Kleinian. Well, the Kleinians aren't as good about, I don't think, talking about it. I prefer the Freudian tradition here of Strachey and Bird, for example, help us see how dramatic a thing we're dealing with. Freud saw it and then didn't see it. Freud described this, as Bird points out, but then Freud retreated from it. And so what does Bird say? He says, sadly, he thinks most analysts have given up on this and have settled for what Freud called the easier part of analysis, which is deploying the interpretive arts. Freud says anyone can learn how to interpret dreams. Anyone can learn how to hear the latent beneath the manifest. But dealing with the transference, Freud says that is the hard part. And Bird says, absolutely. But it's as if Freud pulled back himself and seemed to settle for less. And our field, Bird says, and he's writing, 30 years ago, Brian Bird, our field seems to be settling for less. We're settling for deploying the interpretive arts instead of going into this minefield of transference neurosis psychosis. So what happens? The patient projects their sadistic superego onto us, and they expect us, when they reveal certain things about themselves, they expect us to respond with indignation, shock, disapproval. And if we are sane analysts, we do not react with shock, disapproval, or indignation. And they observe this. We're depending on the reality testing here, which goes against the mirror abstinent thing where the analyst is hiding. Strachey's argument doesn't work for those analysts who have the still face, the poker face. No, the patient has to be able to see that you do not react the way he expects you to react when he projects his superego. So he's got to see that you're not judgmental. He has to see that you are containing. He has to be able to see that. And it's through seeing that things begin to change. His superego becomes modified because you don't react in accordance with the projection. Okay, I think that's a huge insight on the part of James Strachey, that this is how analysis works. I don't think people have picked up on the implication, though, that this argument, that it works through that, is an argument against the complete still-faced, poker-faced analyst. Patient has to be able to perceive you, who you are, in order to understand that you're not the sadist he imagines you to be. Okay, Strachey talks about mutative interpretations. These are the interpretations that lead to change, mutative. And they are transference interpretations, for the most part, interpretations of the transference neurosis or psychosis. superego radically projected, leading to paranoia. Patient is paranoid. And they're seeing that you don't react in accordance with their notion of a plot against them or a conspiracy against them. They begin to perceive that you're not out to get them. You're not out to humiliate them or castrate them. And the mutative interpretations are your ongoing interpretations of what's going on. Strachey didn't think that non-transference interpretations were a waste of time. We help people by interpreting what's going on with the boss, the wife, whatever. But the core of the psychoanalytic process is what's going on between you and me here and now on the unconscious level. So in addition to all of this, steady, careful, non-retaliatory containment and holding, containment in the Bionian sense, holding in the Winnicottian sense, Greenson's working alliance. Plus defense analysis, old-fashioned defense analysis. All of the ways the patient is deviating from free association, all of those shifts of attention to stay away from certain topics, just tracking the patient and drawing his or her attention to defensiveness, and defenses against the transference neurosis or psychosis in an atmosphere of safety and trust. That's what we're trying to achieve, an atmosphere of safety and trust, a working alliance, so that this process of interpreting the projection of the sadistic superego and modifying it. I'm almost at the end. How are we time-wise, Derek?
It's 11 o'clock right now, so we could go for about 10 more minutes and then take a break.
That's fine. I maybe don't even need the 10, but let's do that.
Okay.
Thank you. Okay. So Ron Britton, I have found Ron Britton's work very, very helpful clinically with paranoid, persecutory guilt and shame. He talks about how it is difficult for human beings to link subjectivity and objectivity. Because to link subjectivity and objectivity is to be able to tolerate a coupling, an intercourse between the subjective and the objective that echoes the primal scene, and patients in the paranoid schizoid position can't bear it. They have to keep subjectivity and objectivity apart, like the little kid who crawls into the parental bed to keep them from getting together. Okay, so that we wind up with two different kinds of narcissistic pathology. The thin-skinned narcissist, i.e. borderline, is all about subjectivity. It's all about their feelings. They're overloaded with their feelings. And they can't tolerate any objectivity about themselves. The analyst can't say anything. Famously, Britton is working with one of these borderlines, and he knows he can't give her interpretations. So he says, well, I'm going to settle for silent interpretations. I'm going to interpret to myself what's going on. And then finally she screams, stop that fucking thinking. He's not allowed even to think objectively thoughts about her silently within himself. No, even that's unbearable, intolerable. Thin-skinned narcissist. But then there's the thick-skinned narcissist who can't stand feeling anything. He loves objectivity. He'll intellectualize till the cows come home. He loves psychoanalytic interpretations and psychoanalytic theories. This is schizoid, obsessional types, thick-skinned. And in order to work with them, you have to help them begin to tolerate some feeling. But you also have to give them very blunt, objective interpretations. I mean, I don't recommend the use of a hammer, but with thick-skinned narcissists, you just directly and bluntly confront them, and they can actually take it and do something with it. But the real goal is to get them to begin to tolerate some of their affect, which they dread. They dread feeling. The thin-skinned dread thinking. What's a healthy person? Person who can think and feel and think. Left hemisphere and right hemisphere can interact. And that's the goal. But I mean, recognizing the kind of patient you have enables you to modify your technique to suit the work with that particular type of patient. I mean, with thin-skinned narcissist borderline people, you're essentially doing something that looks like self-psychology for a long time. But the point is that your inner Freudian or Kleinian is just on hold till the day that they can begin to tolerate some objective interventions. But it may be a long time before you're able to come out of the closet as the Freudian Kleinian that you are. You're in the closet, your false self is cohesion. That's necessary. You're waiting. One day, hopefully, you can begin to go to work. So what's the goal? To promote evolution from PS to D, from persecutory guilt and shame to the capacity for concern, care, and reparation. This is an evolution beyond the superego towards the conscience, beyond splitting or beyond the splitting of subjective and objective to the capacity for both feeling and thinking. Psychoanalysis is an ethical practice, not a value-free science. I think I'll hold it there. Thanks for your attention.
Thank you. I think that's a good place to transition to questions. We're going to take a 10-minute break, though. Let's say we'll come back at 1:15, and then if you could put your questions in the chat, and then I will read through the questions, but I will have a look at the questions, and then I will ask you to unmute yourself and direct your question to Dr. Carveth directly. So let's don't anybody log off. Just mute or stay muted. Turn off your cameras if you want, and come back at 15 after. It looks like we're probably ready to start back up.
Okay.
During the presentation, the first question came in from Amy, and I'll just give a summary. If the patient is lying down, then how can we have the corrective experience of them not seeing the poker face? How can we fully convey that with words? And Amy, if you wanted to unmute and dialogue with Dr. Carveth.
Good
Thanks.
question.
That was a great summary of it.
Thank you, Amy. Your question is very good, but I guess I've always thought of the still face is usually accompanied by a still voice. And I think that one can convey one's non-reaction, non-judgment, one's calm, not being shocked, not being disapproving in terms of what you say, even like the noises that you emit. And the more close to psychosis the patient is, the more paranoid they are. I don't feel any need to get the patient off the couch. A lot of Freudians used to strike me as almost as if they were attributing magical power to the couch. And I'm always trying to remind people that the couch is just a hunk of furniture. It does not have magical properties. Can it promote regression? Well, it's not the couch that promotes the regression. It's the analyst's disappearance into silence that promotes the regression. If the patient is regressing, I become more talkative. I become warmer. I become friendlier. I make my presence known. I make a lot of noises. Oh, I see. And I say things. I don't just make noises. When the patient comes out of the regret, I think it was to Chicago. Was it to Chicago? I was talking about the work of now of course I'm blocking on the man's name, a very senior Freudian analyst, Lewin. Maybe he pronounced his name Levine, Bertram Lewin. And he describes how, when we were practicing hypnosis, we literally put patients to sleep, but we abandoned hypnosis. But he sees psychoanalytic technique as putting patients a little bit to sleep, which is why we put them on a couch, and then waking them up a little. And someone very clever in the audience said, but Dr. Carveth, how do you know when to sing and when to ring? Like a lullaby, singing like a lullaby, put them to sleep, ring like an alarm clock, wake them up. Sometimes patients are too tightly wrapped. We want them to regress. But some patients are too loosely wrapped. We want to help them get it together a bit. And we're shifting as the patient shifts, sometimes inducing sleep, sometimes waking up is one way of putting it. So I don't think the patient has to be off the couch. I don't think the patient has to be looking at me to read me, even on the phone. I think there is some research that shows that voice communication often is much more revealing of affective states than visual communication face to face. We should know, because of great actors and actresses, that people can lie with their face very easily. It's harder to lie with your voice. So I take your point, but I think we can deliver the message, and the patient can see the contrast between what they imagine and who we actually are. But we have to be willing, if we're going to work with people on that regress level, we have to be willing to express ourselves.
Thank you. That's fascinating. I always think of the voice being able to lie more easily, but maybe I'm confusing voice with words.
Yeah, I think so. Certainly we can lie with the words, but the sounds often don't accompany, or we sense a discrepancy.
Mm-hmm. Thank you.
Thank you for the question.
Camilla had a question about the dynamics of religious shame and guilt. Camilla, could you unmute?
Yes, thank you. Just the connection between religious shame and guilt in a person that can intellectualize and rationalize the two logics of societal norms and religious norms, and the overactive superego that's in play between these two dynamics.
I'm wanting you to say more because it seems to me that we're still dealing with a very judgmental superego. It's generating shame and guilt, but it's coming from a religious superego. But it could equally well come from an ideological, political superego that's shaming you for, you're politically incorrect. And from their standpoint, you're politically incorrect. Look, many of us are walking around frightened, not only because of the Hamas-Israel conflict now, but for many years we're walking around feeling very vulnerable to sudden ambushes from moralistic people around us who are determined to shame us and sometimes cancel us for politically incorrect speech. So I think the kind of superego you're talking about doesn't have to come from religion. I mean, it can come from political ideology, right? Or are you thinking of some kind of specific thing about religious superego?
I guess the struggle is sometimes the political ideologies are intertwined with the religious aspect, depending on which country you're from. So I'm struggling to separate the two because I think they're intertwined sometimes. So if a client is struggling with that and it's creating dysregulation, how do we help them understand that?
I guess. Well, first of all, it depends on how thin-skinned or thick-skinned the patient is. I mean, if they're not terribly thin-skinned, you can talk to them, at least. You can point out what's going on. I guess I tend to say to patients, I point out how they have this sadistic inner judge. He's not a reasonable judge. He's a hanging judge. This is their enemy. I say, this is your enemy. I say, it's our enemy. I sometimes say, like, you and I are kind of like a underground resistance cell working together to liberate you from the tyranny of this tyrant. And because that tyrant is not out just to destroy you, it's out to destroy us. That tyrant hates me, your therapist, because it knows that I'm trying to liberate you from slavery to it. So it hates me. It hates the work we're doing. It's out to crush you. We have to overthrow it. We have to learn how to stand up to it. How do you do that? How do you begin to stand up to a bully? Really, let's make it simple. Okay, the superego is a bully. And how do you begin to find the courage to stand up to a bully? Oh, you've opened up a really rich vein here. How do you do that? One of the things I say to patients who are really actively being crushed by the superego is, I said, listen, you have to change your life and conform with your conscience. You have to bring your life into line with your conscience, not your superego, your conscience. In other words, you have to become a more honest, more loving, more caring person. And there may be some of your favorite sins that you're going to have to give up. Because when you yourself are acting in unconscionable ways, out of sync with your conscience, that gives the superego an opening to destroy you. It's like the Gestapo, if it catches you, it loves to catch you in sin, because then it can do what it wants, which is just demolish you. So when I say you have to become a better person, I don't mean according to the superego. I mean according to your conscience. And the conscience is governed by values like loving versus hating, kindness versus cruelty, life as opposed to death. So to the extent that, you see, because if you move closer to, in your behavior, your daily behavior, you move closer to your conscience, you are becoming more likable to yourself. You know, and now you're at peace because you like yourself. Well, then the superego comes around and tries to bully a person who likes himself. Well, fuck off. I like myself. You can't do that to me. Go away. The ability to get the superego to back off has an awful lot to do with the level of your self-esteem. If your self-esteem is low, it's going to have you for breakfast. So that's an important element, I think, of the kind of thing one advises. I give advice to patients. I say, you know, you got to give that thing up. Maybe it's that porn thing, or it's something, because obviously you really hate yourself for doing that. Maybe if you stop doing that, you'll be able to back the superego off. And this tends to work. But it means the patient becomes committed to a lifelong struggle to be a better person. Now, this sounds, today in the culture of narcissism, this sounds like a shocking idea. But for many people, for many centuries, that's what life was. You know, people talk about meaninglessness. They have trouble finding meaning. I'm saying, how about the meaning of a daily struggle to be a better person? Okay? How about finding meaning in that? And to the extent that a person does get into that and starts to find a meaning, and they start to get the payoff of genuinely liking themselves, and I'm not talking about narcissistic getting puffed up. That's not, I'm talking about a genuine respect for oneself, self-respect. Oh, God, you know, I keep coming back to something my father said to me when I was a boy. And boy, did he ever nail it. He said, son, there's only one person you have to live with 24/7. And that's yourself. Well, that is so true. So if you have to live with yourself 24/7, you better get to like yourself. Well, how do you get to like yourself? By moving in the direction of your core values, your conscience. And now the superego can't hassle you so much. You can stand up to bullies. Yeah.
Sarah Warren had, oh, I'm sorry, Camilla, did you have any follow-up question? Okay. Sarah Warren had a question about the how the recognition of the patient being in the paranoid, schizoid, or depressive position informs how we work with them.
Well, it's a little bit thin-skinned, thick-skinned. Sorry?
Yeah, I wanted to see if Sarah is here, if she wanted to formulate the question directly. Oh, Sarah, you need to unmute. Let's see if I can find you and I can unmute you. I will unmute you. Oh no, it says ask to unmute. Sarah, if it's okay, I can read your question directly.
I was successful in muting myself.
Okay, excellent.
So I'm on my phone and it's not conducive. So I'm really appreciating your remarks and how grounded they are in really the history of the tradition of psychoanalysis, and really going back in a way that respects the roots of our field. So my training in the 80s was a lot of the British Object Relations School on the one hand, and a lot of sort of Merton Gill analysis of transference. And I struggled early in my career. I had some appreciation for certainly for character pathology and how that makes a difference in terms of people's object relations. What I didn't understand was the technical implications of that understanding about how someone is organized. And so I found myself early on working a lot, regardless of my understanding of someone's personality organization, on the transference. And I think that there's still a lot of emphasis in the field on the treatment relationship, and that's kind of where the work is. And I'm just wondering if you have found that sometimes when we fail to appreciate the implications of how someone is organized, and we work primarily on the relationship in the treatment, if that can become an experience that's difficult for someone to tolerate if they're organized at a paranoid schizoid level.
Yes, for sure. There's a wonderful paper, it's not an easy paper to understand, by Wilfred Bion. Oh gosh, I can't think of the title right now. I did a series on my YouTube channel, 4 lectures on Bion, and this paper is discussed, I think, in the 4th of those lectures. But the patient is trying to communicate to the therapist that the therapist just doesn't get it. The patient is trying to say, listen, okay, let me put it into my language. The patient is trying to say to the therapist, listen, you're trying to treat me as if I'm neurotic, but I'm not neurotic. And you don't understand that. You keep trying to communicate to me in a way that would work if I were neurotic, but I'm borderline. You don't get it. So that kind of is the point. I think if we begin to realize that, okay, this patient is functioning on a paranoid schizoid level, I can't operate the way I would with a neurotic. For me, personally, I've got to shut up a lot. The patient can't tolerate my blah, blah, blah. They can't tolerate my thoughts about them because that's objective. That's outside about the. I have to shift entirely. And I think, in my mind, that's a shift in the direction of cell psychology for a long time. Empathic, attunement, kind of non-interpretive, a bit of interpretation, certainly a bit of interpretation around disruption repair cycles. They get disrupted. We try to figure out what caused the disruption. We discuss that. And in the act of discussing the disruption, there's an implicit repair, and attunement is restored, affective attunement. So I tell myself this is the nature of the work I'm going to be doing with this patient for a considerable time. Mm-hmm. And then something happens that alerts me to a change. There's a paper by the Genevan analyst Kinados. He wrote a paper called A Dream That Turns a Page. And he's talking about patients who sometimes bring a dream that announces a real turning point in the treatment. And sometimes this borderline patient will do something that indicates a new receptiveness to more interpretive action on my part. They can tolerate some confrontation. I don't like the word confrontation. It sounds aggressive. It doesn't mean that. It just means drawing the patient's attention to something, pointing something out. That's objective from an external point of view, but maybe now they can tolerate a little bit of that. Mm-hmm. And I can shift the technique.
Mm-hmm. Mm-hmm.
Yeah.
Yeah, and I appreciate that. Thank you. I think sort of a less is more, and less is non-persecutory, right? That more can be persecutory.
Very persecutory. Well, yeah, and the patient will let me know that they're feeling persecuted by what I just did. And I have to see that and I have to decide, okay, I have to change.
Mhm.
Yeah.
Thank you.
Thank
Thank
you.
you.
Oh, can I just tell people, I looked up the Brian Bird paper, but I think it's gold. It's 1972 in JAPA. It's called Notes on Transference, Universal Phenomenon and Hardest Part of Analysis by Brian Bird, 1972, JAPA. Highly recommend that paper.
Marty or Marty had a question about the goal of psychoanalysis. Can we say that the goal of psychoanalysis is not conversion, but simply a vision of how things are? And I'll let Marty complete the rest of that question.
Oh, hi, Don. It's really nice to see you again.
Hi, Marty.
Well, first I wanted to give an example of reparative shame because you threw down the gauntlet
Yeah.
because you couldn't think of one. So I thought I'd share a story. You don't have to respond to it. I've been turning it over during the break whether it exactly is reparative shame. And it's also a nice story, which we like in psychoanalysis. It's a story about Liberian peace process. And when Ellen Johnson Sirleaf and the Women for Liberia were trying to bring about peace, all of the warring factions were in a conference room in Ghana, in Accra. So the women surrounded the conference room on a Sunday and said, "You can't leave until we get peace." The security guards came to take them away. So they simply started to take off their clothes. And the security guards refused to do anything with them. So they actually bottled up all these warring factions and peace came about.
Wow. 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 That's an amazing story.
So I just leave it right there. There, but my question was, I mean, there's a lot of questions, but this question of conversion, aren't we really saying, or aren't we really attempting to see that, to see the perversion of the superego? I mean, Lacan says the pervert is the one who fulfills the will of the superego, of the big other or whatever. And so, and there's a perverse enjoyment to my self-loathing or my self-persecution.
Right.
But I don't see how I secretly enjoy that. And the moment that I do, the moral choice is not the analyst's, it's me, the analyst's end. Do I want to hate myself?
Right.
And I'm not sure what, and so this, and I with the risk of being kind of chaotic or overreaching. I mean, the judge of the judge is God, and so in a sense, and I think Lacan has said that as soon as we repress, we say that God is there because we don't want him to see what we're repressing, in a sense. Anyway, there's a so I would argue, So I would argue that psychoanalysis is very scientific in it lets me see what's going on as an analysand, and
Right.
therefore I change. It's not that you convert me, so to speak.
Sure. Well, first of all, let me say, in talking about conversion, I certainly did not mean to suggest that the analyst converts the patient. I was suggesting that something like a conversion happens, but not that the analyst is doing it to the patient. It happens. And I think you're saying it happens too, but you're much more comfortable with the idea that it happens in the background silently, that we don't even have to address it, because if we help the patient study their mind and the way they operate, it will happen automatically, because there is a conscience, and the conscience will kick in and the patient will decide to change. I agree with that. I think most analysts would be much more comfortable with your way of putting it, because analysts are very alert to the danger of being superegoish or pushing conscience, and they should be right. They're right to be concerned about that. But I like to draw things out into the open. I'm saying you're assuming conscience. And analysts would prefer to go on assuming it and not speaking about it, because if we speak about it, then it begins to appear that there is a conversion happening, even though we're not making it happen. And, should OHIP, socialized medicine, pay for helping to make bad people good? Is that something the government should pay for? I don't know. I think most analysts are very committed to a secular humanism. Many are atheists, many are agnostics. Many have been harmed by institutional religion. They want no part of it. And they're very sensitive to words like sin, for example. I try to substitute the word wrongdoing to avoid that overloaded word sin. I mean, they want to preserve psychoanalysis from corruption by religion. And but it sometimes leads them to not want to spell out something that is going on. So I tend to go in the opposite direction, and I will use a word like conversion in order to drag this out of the background, and so that we can see that we're counting on it, even though we don't want to speak about it.
Right, right. Yeah, it's kind of, where do you put the pathoanalysis? Do you, where do you, and so you could say that psychoanalysis is a pathoanalysis of what's wrong, in a way, of what's going on. But then you get into the question of normativity.
Yeah. Well, my son is a post fourth year candidate here, and so he's more conservative than me. He's in love with defense analysis, old style Freudian defense analysis, just paying minute attention to the ways the patient moves away from free association, dodges, changes the subject, these small things, And I think he's having a good effect on me, because I value that kind of work as well. And I think if you do that, a lot of this will take care of itself.
Thank you. Yeah.
Yeah, thank you.
Alex Tucker had a question about distinguishing between genuine conscience and neurotic adherence to the values at the expense of sociality. Alex, did you want to?
Sure, yeah. I mean, so I know you kind of mentioned, Dr. Carveth, about how people who live in conscience tend not to be team players. And that does square with my intuitions, but I'm wondering about this matter of someone having values that supersede social loyalty, sociality, and how we can practically distinguish conscience from something else, something potentially more pathological or kind of more defensive, more rigid, less adaptive. So I'm curious about your thoughts.
Well, yeah, I think when people are acting sort of against the group, and claiming that they are conscientious objectors, anyone with any psychoanalytic awareness is going to want to be a bit suspicious of what might really be going on. I mean, is their departure from the group really conscience, or is it their exhibitionism? Is it their narcissism? Are they justifying narcissistic exhibitionism, or just defiant disorder? Their need to defy? What's going on? They're saying it's an act of conscience. Is it really, or is there all this other stuff going on? That's a perfectly good, legitimate question. We have to ask that to ourselves when we are objecting. I mean, this happened to me a while ago. I kind of tend to lead sort of like the more liberal forces in my institute, and we were challenging a rule that the conservatives were completely in love with. And I'm the one who brought this and put it on the table, and we had to vote. And the first time we had to vote, my side won, but the other side eradicated the vote on the grounds that I was phoning into the meeting from Florida. So then we had to bring it back. And I'm sitting there looking at the colleagues, and I realize that I have the votes to win this vote. People are there. I'm going to win. But I can't bring myself to call the vote because I'm questioning my motives. Am I acting conscientiously, or do I want some of these senior colleagues to have a stroke because they look like they might not make it out of the room if they lose? Am I doing this out of some perverse hostility to them? Am I doing it just out of sheer narcissism? Why am I doing this? I'm asking myself. So meanwhile, the evening ended. I didn't call the vote. It came back on the table the following month, and I got into the same kind of paralysis until one of the senior colleagues made a mistake and accused me of playing politics when all he'd been doing for months is play politics around this issue. I got angry. I called the vote. We won. Some of these colleagues walked ashen-faced out of the room. I didn't sleep well, but I didn't sleep that badly. I wasn't accusing myself too much, persecuting myself too much that night. Okay, well, what am I saying? We have to question motives, but sometimes people who are quite convinced can do guilt induction. Nietzsche is the great theorist of guilt induction. If you're a peasant population and you're confronted by Romans on giant horses with armor and swords, if you engage in a direct fight, you're going to lose. So what do? You come up with a religion that says the meek shall inherit the earth. The strong are bad. It's bad to be strong. If you can get people to believe that, they'll fall on their own sword. So that's guilt induction. It's a wonderful technique. If you can get your enemy guilty for being strong, you can have them for breakfast. And so some conservatives are very good at making radicals feel guilty for being radicals. Like their attitude is, you must know you're just being a bad boy, Don. You must know that you're just plucking at our authority out of sheer no good reason, Don. So my superego is booted up by that. My superego is now undermining me with this very question you're raising. Is it conscientious, or is it something else masquerading as conscientious? You can. So, okay, look, it's complicated. I guess that's my answer.
Thank you very much.
Thank you.
Margaret Nichols had a question about what brings about persecutory guilt, whether it's perhaps it arrests a developmental phase. Margaret, did you want to?
Yeah, of course. I'm here in Chicago. I am teaching at the Chicago Center for Psychoanalysis. I'm teaching there for the last four years their course on psychoanalytic theories of child development. And what I'm trying to do is actually look at classic psychoanalytic theories of child development and compare them with more kind of over the last 30, 40 years, theories of psychodynamically informed, relational informed infant mental health development. And I was for many years at the Erickson Institute here in Chicago, and I taught infant and child development, and created a center that provided parent-child psychotherapy for parents with children birth through age 8. So this is just to frame my question, Dr. Carveth. I was very, very eager to hear what you have to say, and I very much agree, based in my clinical work, also based in seeing behavior problems in children in the light of kind of excessive guilt that has all kinds of expressions in the parent-child relationship, aggression, for example, or self-regulatory issues with potty training and so on. So my question, though, is, I have seen persecutory guilt everywhere in my
Yeah.
clinical work with children and adults. And you say it's not narcissistic, which rings true to me because of the almost like a compulsive holding on to this guilt that I see working with currently with patients I see, but also in children, the retentive issues like in potty training. But my question to you is, how do you explain persecutory guilt in terms of what happens in a person? How do they get there? Is it like Melanie? Are you thinking that according to the Kleinian theory, it's maybe an arrest in the in the persecutory phase? Is it just we all go through this and somehow people get arrested there? Or are you saying that there are external experiences, like relational experiences, for example, that can lead to this kind of persecutory guilt that maybe out of a self-defensive endeavor becomes narcissistically invested? Because so far I'm not exactly sure. So I always think that the etiology helps me certainly understand picking my therapeutic stance with the patient. So on the one hand, you're saying it takes intensive psychoanalysis and the transverse neurosis to work through this. On the other hand, I have to say some of the examples you gave sound to me a bit like cognitive reframing, and so which has not helped for the patients that I'm working with. For example, I have one patient who has gotten to the point where she can say that she has an internal governor who does not allow her to stop feeling she goes to sleep guilty and she wakes up already dreading all the things that she's going to do badly during the day. And she can see that when there are openings that are offered to her to get rid of that governor, she cannot take those. So just to say, go ahead and do it, I'm not sure. And so I'm thinking, if you could explain a little bit how you understand the etiology, it would certainly help me in my clinical practice. And also I could kind of think about that in terms of child development.
Well, that's quite a series of questions. It makes me want to take your course. Etiology is something that I'm very uncertain about. It's a bit of a mystery to me. I think it was a mystery to Freud. I mean, you know, he often said like the origin of artistic talent. He says psychoanalysis must lay down its arms in the face of that question. You know, I'm more inclined to see what's happening now. I'm inclined to not get involved with how did this, well, of course I get involved with how did this happen, because the patient is telling me about their childhood history and their family. But like many Kleinians, I'm very suspicious of the stories about parenting because they vary so much. At the beginning of the analysis, the patient tells you their parents and what the family was like, and they're like, 7 years later, the story is completely different. Mother is not looking so good, father's looking worse, or vice versa. I think most Kleinians think that it's only at the end of an analysis, when you've seen how the patient distorts what's going on between you and him or her, that you begin to think, well, maybe that distortion went on with the parents too. Maybe by the end of the analysis, you get some sense of what the childhood was really like. But I'm less interested in figuring all that out than I am helping the patient make positive changes here and now. I'm not so convinced that in order to make positive changes here and now, we need to spend as much time as we've been inclined to spend on genetic history. I'm not convinced that getting ideas about how all of this started is necessarily going to liberate me from the problem now. I agree with you that just saying go ahead and do it, that's not very useful. Part of what I'm thinking as I listen to you is, Freud's, and here he was following Melanie Klein. He actually credited her in Civilization and Discontents. You can't assume that a harsh upbringing leads to a harsh superego. Sometimes a very kindly upbringing by very liberal, tolerant parents can lead to a very harsh superego, because the parents, to do their job, are going to have to frustrate the kid inevitably, and that generates aggression, and you can't attack such nice, lovely, liberal parents. So what are you going to do with the aggression? You're going to turn it on yourself.
Right.
So I think he's quite right about
it. Yes. But so my follow-up question is, to me, I'm not a psychoanalyst, although I read Freud together with Marx in my 20s.
Right.
Since most of us who are actually also interested in your talk and in a lot of this psychoanalytic theories don't really exclusively or practice psychoanalysis, I personally find that understanding child development and actually helping the patient and oneself internally link the patient's experience and why there is a governor and so on, and also how they see ourselves. We have some kind of understanding of what happens when we see, or what happened when we see certain clinical constellations. And if we help the patient link that back to their childhood. So for example, I'll give you an example, and then I'm one of the things that this patient that has the governor and has part of her in a dungeon, that's our image, what she has told me very early and repeated over in many instances is that her parents always told her from little on how much they sacrificed for her benefit. So she was constantly given the message that she is too much and too draining, and her parents would have been much happier if she were not in their life. So she was the destructive force in her parents' life. And so children, we know from
that's
children,
guilt induction, big time.
Guilt induction, and also when this is the relational pattern, the anger about not getting enough cannot ever be expressed because even basic regular needs are already destructive. So, I'm just saying, knowing that is, to me and many of the, people I've worked with, very, very helpful.
But do you carry it then? Because that's the other point I was going to make. Where does the persecutory come from? It comes from anger turned against self, rage turned against self.
Yeah.
So in addition to understanding the family context in which the child would choose to repress the anger and not be able to deploy it against the objects, I can see that to be useful. But I would go further and tell the patient how she is continuing to repeat that, even though she's no longer in the context which made sense of it, but now she's an adult woman, and now she needs to learn how to mobilize her anger. So I'm both understanding where it came from, but I'm also saying it's time to change. It's 2023 already.
But I think it helps the patient understand why they have a right to mobilize the anger rather than just trust me. Because it started off to be a wrong from the very beginning.
Yes.
So that's,
I agree.
But anyway, thank you very much. I think that the topic is enormously important.
Oh, thank you. Well, I think the teaching that you're doing, trying to align these concepts, is very, very useful and interesting.
Thank you.
Let me take an example of your question to make another point. I don't want to be perceived in terms of celebrating the analysis of the transference, neurosis, psychosis, full-scale, old-style psychoanalysis. I don't want that to be seen as a devaluing of analytic psychotherapy. For years, I've done both, and there is a need for both. And I think there are many patients who are just not suited, and probably with whom we shouldn't undertake the risk of a really regressive transference neurosis. They can do quite well without that. I don't think that is the sine qua non of psychoanalytic work. For certain patients, it is necessary for some patients. They're not going to get very far, but other patients can do quite well without getting into that level of regression. So I see a perfectly legitimate space for psychoanalytic psychotherapy. I don't mean to valorize psychoanalysis at the expense of psychoanalytic psychotherapy. Okay.
Thank you very much.
Thank you, Dr. Carveth, and we thank you for coming back and talking with us again. I think this was a wonderful talk, and I very much appreciate all of the questions and discussion as well.
Thank you, Derek. I've enjoyed myself.
Thank you. We'll sign off in a second. I just want to remind everyone that we will be sending out a questionnaire today, and the questionnaire will need to be sent back, and then you will be sent the certificate for continuing education credits. That probably won't be done for the next couple of weeks because the person who is responsible for that is on honeymoon at the moment. So we can't hold them to account right now. Also, that is the person that will be doing the editing of this talk for the video. So that will probably be done in the first couple of weeks in December. So please keep your eyes out on the email for the evaluation form, and then also later on for the video. Thank you, everyone. Thank you, Dr. Carveth.
Thanks a lot.
Bye-bye.
Bye now.